Welcome to the Doctors and Clinicians Preview Period Performance Information. This video goes over how clinicians can preview their Quality Payment Program or QPP performance information for public reporting on the Compare tool on Medicare.gov and in the Provider Data Catalog, or PDC. Performance information available for preview and public reporting comes from the Merit-Based Incentive Payment System, or MIPS, and from Alternative Payment Models, or APMs. At the time of this video's publication, the included information is correct and up to date. This video is a tool to help clinicians and doesn't grant rights to or impose obligations on participants. Note that every reasonable effort has been made to ensure the accuracy of this video's information, and it's ultimately the provider of services' responsibility to correctly submit claims and respond to any remittance advice. This video explains parts of the Medicare program but isn't legally binding. Official Medicare program provisions can be found in the relevant laws, regulations, and rulings. Medicare policy changes frequently, and this video has links to source documents for reference in the video description. The Centers for Medicare and Medicaid Services, or CMS, employees, agents, and staff make no guarantee that this video containing Medicare information is error-free, and they bear no responsibility or liability for the results and consequences of this video's use. Note that all MIPS performance information for the most recent performance year that will be previewed and publicly reported met CMS's statistical standards for validity, reliability, accuracy, and comparability. No performance information will be publicly reported for MIPS performance categories that were reweighted to 0% through the extreme and uncontrollable circumstance, or EUC policy. If the reweighting or targeted review request is still in progress, you can still preview your performance data. If your final score changes due to a targeted review, check your updated performance feedback through the performance feedback link on the QPP website. Clinicians and groups have an opportunity to review their performance information before it's publicly reported on the Compare tool on Medicare.gov and in the PDC. The Doctors and Clinicians Preview Period is the first chance for clinicians and groups to review their performance information before public reporting. Voluntary reporters, as in clinicians and groups that weren't MIPS eligible but submitted data, can also preview their performance data and opt out of public reporting unless they opted into MIPS for a payment adjustment. Clinicians and groups can preview their performance information in the Doctors and Clinicians Preview section of the QPP website. The following are who should preview their performance data on the QPP website: eligible clinicians, groups, and virtual groups that submitted MIPS performance information. Clinicians, groups, and virtual groups that aren't MIPS eligible but voluntarily submitted MIPS performance information. Groups that submitted Consumer Assessment of Healthcare Providers and Systems, or CAPS, for MIPS survey data. Accountable Care Organizations, or ACOs, can preview their MIPS performance feedback or Medicare Shared Savings Program quality performance reports, but ACO data isn't included in the preview period. Now let's walk through how to preview your performance information. Log in to the QPP website with your Healthcare Quality Information Systems, or HCQIS, access roles and profile or HARP, user ID and password. If you forgot either or both of these, visit the HARP Forgot User ID or Password webpage to recover your user ID and/or reset your password. If you don't have an active HARP account, review the QPP Access User Guide and register for one through the HARP Create an Account webpage. Note that to preview your information, you must log in with either a security official or staff user role. You can't access performance previews with a clinician role. After you've logged in, select Doctors and Clinicians Preview from the side navigation menu. You'll then be taken to the Doctors and Clinicians Preview landing page. Up until now, the steps have been the same regardless of whether you want to preview individual clinician or group performance information. The next steps are slightly different depending on what level of information you want to preview. To preview group performance information, find the group you're interested in and select the View Practice Details button to go to the group's overview page. Note that if your HARP account is connected to a virtual group, you can preview available performance information by selecting View Virtual Group Details in the Virtual Groups tab. To preview group performance information, go to the Practices tab and then select the View Practice Details button. If you're a clinician who's part of a group and wants to preview individual data, go to the Group Preview landing page, navigate to the Connected Clinicians section, and select the View Individual Preview button for the individual clinician of interest. If you're a clinician or previewing data on behalf of one, you must log into the QPP website with a security official or staff user role. Some clinicians and groups may not have performance data to preview if their submitted information wasn't selected for public reporting or wasn't submitted at all. Note that if your HARP account is connected to a virtual group and you want to preview individual clinician performance information, go to the Practices tab and select the View Practice Details button. Then follow the steps at the top of the slide to view clinician performance information. Let's walk through each of the categories of information to preview, starting with quality. To view your or your group's quality performance information planned for public reporting on profile pages, select Quality from the side navigation menu. Remember that if you don't see Quality in the side navigation menu, it's because you don't have any information to preview for that category. On the Quality page, you'll see one or both of these tabs: Performance and Patient Survey Scores. The Performance tab displays MIPS and Qualified Clinical Data Registry, or QCDR, quality measures as star ratings. These will appear only if you have MIPS or QCDR quality data. The Patient Survey Scores tab shows caps for MIPS surveyed measures as top box % scores. This is for groups with available data only. To review these scores, select the relevant tab. Promoting interoperability performance information may also be available for you to preview. Start by selecting Promoting Interoperability from the side navigation menu. If this tab doesn't display, it's because you don't have any Promoting Interoperability information to preview. The Promoting Interoperability page may display one or two tabs: General Information and Performance. The General Information tab shows whether you were a successful performer in the electronic health record category. Green check marks indicate successful attestations, and a yellow caution symbol means that there are negative attestations on information blocking. The Performance tab displays promoting interoperability measures with star ratings. This information will be publicly reported on your profile page. Clinicians and groups can also preview how improvement activities will be reported on their profile pages. Start by selecting Improvement Activities from the side navigation menu. On this page, you can preview a list of improvement activities planned for public reporting on your profile page. The improvement activities display as green check marks. All of the performance information shown so far is selected for reporting on profile pages. This will be publicly available in a downloadable format, which will also include additional performance and general information not selected for reporting on profile pages. Select Provider Data Catalog from the side navigation menu to see what information will be published for you or your group. On the PDC page, you'll see your performance information for public reporting. Only your or your group's data is shown. People often ask whether they can download this data during the preview period. Since it hasn't been publicly reported yet, you can't download it. Be sure to expand each collapsible bar to review your information. You may see up to two sections. For clinicians, the possible files are the Clinician Performance Database and the Final Score and Performance Category Scores Database. The Clinician Performance Database has performance information planned for public reporting on profile pages and additional performance information that's planned for public reporting, but that wasn't selected for profile pages. The final score and performance category scores database MIPS final scores and performance category scores. Groups may have up to 2 files: the group performance database and the patient experience database. As with the clinician performance database, the group performance database has MIPS and QCDR quality, promoting interoperability and improvement activities, performance information planned for public reporting on profile pages, and additional performance information that's planned for public reporting, but that wasn't selected for profile pages. Caps for MIPS survey scores are in the patient experience database. Eligible clinicians and groups can opt out of public reporting only if they're a voluntary reporter, meaning they submitted MIPS performance data, but weren't MIPS eligible for the performance year. Clinicians or groups that opt into the MIPS payment adjustment can't opt out of public reporting. Also, voluntary reporting doesn't apply to qualifying APM participants. This opt-out decision applies to the current performance year only and doesn't affect future public reporting. If you don't opt out, your data may still be publicly reported. Now let's go over how to opt out. First, go to the Overview page by selecting the View Practice Details or the View Individual Preview button. If you or your group are eligible to opt out, you'll see a link that says, "Click here to opt out of having your MIPS performance information publicly reported." Select this link. After selecting the link, you'll see a screen showing the clinician or group name. Review this information carefully and verify that this is you or your group. Then select the Opt Out button to continue to the confirmation page. Remember that this decision is final and can't be changed later. Once you confirm your decision, you won't be able to opt back into having your performance information publicly reported for the performance year, so consider this decision carefully. Confirm your decision by entering Confirm into the text box and selecting the Confirm button. Next, verify that you successfully opted out. At this point, you won't see a link to opt out of public reporting. Instead, you'll see a message saying you've chosen to opt out of having your performance information publicly reported. This concludes Preview Period. Performance information for doctors and clinicians. If your scores don't match your performance feedback report, if you have additional questions about the doctors and clinicians preview period, or if you have feedback on what we presented, contact the QPP Service Center by emailing qpp@cms.hhs.gov to receive announcements of when the 30-day preview period is open each year. Subscribe to the Care Compare, Doctors and Clinicians listserv at the URL on screen and the link in the description. You can find more information and resources about the preview period on the Care Compare, Doctors and Clinicians Initiative webpage at the URL on screen and the link in the description.